Dallas, Texas, just between patients, and here to answer any questions you might have regarding BFR. So feel free, if you have any questions, up in your upper right corner, you can see a place called chat, and I'll type it in here. Questions. Here. All right, so I usually reserve the first couple of minutes answering any questions that people might have, and then can go into anything else we might want to discuss regarding BFR for the next 15, 20 minutes or so. All right, no questions. Okay, so we talk a little bit about programming then, and I think one of the most interesting things around BFR is being able to utilize the same exercise that you normally would, just using lighter loads, and not taking the reps all the way to failure unless that's your goal. So we have multiple ways that we can program. You can be super creative, and you really want to just try to augment what your normal training patterns are the best way possible. So for example, if I'm doing my normal workouts, but I have a certain area of my body that I really want to increase the size of the tissue, I might do my normal CrossFit workout, and then I might add a supplemental exercise to the end of a workout a couple of days a week. Maybe I'm wanting to work on my shoulder to overhead pressing. So I feel like my upper body pressing movements are a little bit less strong as I would really like. So what I can do is I can add 2 to 3 adjunct exercises to that routine. So I finish my normal workout without BFR, and then I add a shoulder overhead press using 20 to 30% of my 1 rep max. Those can be dumbbells, those could be barbells, those could be anything that you really want. We know that we use the 30 repetitions. Type this in. Normal programming is 30 repetitions, 30-second rest, 15 repetitions, 30-second rest, 15 repetitions, 30-second rest, and lastly, 15 repetitions. Then deflate. So you're, oh, can't see me. That's weird. My mic's on, my camera is on. you see me now? Because my it's showing that my video is on. It's showing my audio is on. Okay, so so this is what your normal rep scheme is going to look at. Now, does your body know that you could do 32 reps without getting to failure? No, it doesn't know. Really, we're just trying to we're using a light enough load to make sure that we don't cause more damage to the tissue. And we can do right around this 75 reps per exercise. So I just finished my normal workout. I want to do some adjunct work as like a finisher for my upper body pressing motions. I could do shoulder overhead, I could do a modified push-up, and I could do a pull. We're going to be looking at 3 to 5 exercises max. And because I'm not taking all those to failure, I could technically do those every day, every other day. We want to do it at least twice a week. Better to do it 3 times a week in order to get the max effect. So 3 times a week would be ideal. So if you're going to do these adjunct exercises, you might do upper body as an adjunct one day. The next day, you'll do lower body exercises as an adjunct. Upper body adjunct, lower body adjunct. Or you could split it. You could do all shoulder. You could do all chest. You could do all bicep, all tricep. However you kind of want to do it to be creative, depending on what you're looking for. Now, if I'm looking to just increase size, like, you know what, I'm getting ready for the beach this week, and I want to make sure that my biceps are as large as they can be. I want to try to create some hypertrophy to that, more size to that. I would look at more isolated type exercise, straight bicep curl or concentration curl. Maybe I do some hammer curls. Isolated exercise meaning just single joint exercises versus a rowing exercise where I got both shoulder, elbow, and probably a little bit of wrist motion as well. So we think about, for hypertrophy, aka size increase, muscle size increase, I'll put MM as muscle. We use isolated exercises more, or single joint. And that's where you're going to be able to probably use a little bit more load or a little bit more weight, and you're going to be able to maximize that growth potential. Does strength and hypertrophy always correlate? The answer is no. There are, you can increase size without necessarily increasing the strength of the tissue, because you're using really, really light loads for the most part. This goes for BFR or non-BFR as well. Now, what if you can't do regular lifting, and so you're just focusing on BFR training? You're looking at somewhere between 3 and 5 exercises per workout. I would tend to do a couple single joint and a couple multi-joint, and create a little bit of variety with those. So your multi-joint exercises are going to be much more taxing, much more central and peripheral nervous system fatigue. So you're probably not going to be able to do as many. So for example, if I was going to do a long arc quad exercise, just want to focus on my quad. I'm doing a long arc quad. Because I'm only moving one joint, this is an isolated exercise compared to doing a air squat. Okay, air squat's going to be much more taxing. We're probably not going to be able to do as many multi-joint exercises. And you can vary how those are utilized. You could do multi-joints first, which is what I would do, and then finish with isolated exercise afterwards. So my first exercise, if I was doing lower extremity, might be an air squat or a TRX squat. I complete the 30, 15, 15, 15. I deflate the cuffs. I then go to isolated exercises, maybe a hamstring isolation, a quadricep isolation, and then a calf isolation, 3 different types of exercises. So I hit the whole lower extremity. I would be pretty fatigued by the end of that, and that would be enough. That would be done. And then the next day I would do upper body, and you could alternate that way as well. Of course, I also recommend doing some sort of aerobic conditioning, and you could do that as a whole separate exercise time. You could do that in the morning on your morning walk for 20 or 30 minutes, and then do your strength training in the afternoon or vice versa. If you don't have time to split it, then do it together. But you're looking at about 6 minutes and 40 seconds for each exercise with this 30, 15, 15, 15 with a 30-second rest in between. So you could be through your workout in 30 minutes and be pretty fatigued and pretty done. So any questions regarding programming for BFR? All right, if no questions, I'm going to sign off. And feel free to reach out to me at edlacara.com anytime if you have any questions. And I could also utilize those questions in our next session. Thanks so much for joining, and we'll see you next week.